Everyone, this is Jenny Babcock from ACAP. I am currently ACAP's Vice President for Exchange Policy and Director of Strategic Operations, at least for the next couple of weeks. Welcome to the latest ACAP Vendor Education Series webinar. I'm happy to have with me today Eugene Sayon, the founder and CEO of Softheon, and also Richard Lee, the Senior Vice President of Finance at Community Health Choice in Houston, Texas. Together they will be presenting a webinar called Case Study, How One ACAP Member Overcame Challenges and Achieved Success on the Federally Facilitated Marketplace. And they achieved enormous success, as Richard, I'm sure, will let you know. Applause to them. So that you all know, the purpose of the ACAP Vendor Education Series webinars is to allow ACAP's preferred vendors share their expertise on topics that are of interest to and are of use to ACAP health plan members. It is just one aspect of our ACAP Preferred Vendor Program, but I think a particularly important one. So thank you all for joining. Before I turn this over to Eugene and Richard, I want to make a few housekeeping announcements. This webinar, along with all ACAP calls, webinars, and meetings, will be held in accordance with the ACAP antitrust guidelines. The guidelines can be viewed on our website. If you want to see them and don't know where to find them, just send me a note and I'd be happy to help you out. ACAP is recording today's webinar. We plan to post both the recording and the slides that you will see on our website, and we will send a link around to our plans shortly after the call. You may feel free to share that with any other ACAP plan staffer. Note that this link will lead you to ACAP's website behind the member wall, so you'll have to get your ACAP member, website log on. Please keep your eyes open for additional webinars that are scheduled throughout the year. Most take place on Tuesday afternoons at 2 p.m. and Thursday afternoons at 2 p.m. at Eastern Time. Our list of ACAP preferred vendors is on the ACAP website. If you look at the main site and then look to the right, on a banner to the right, there's a button that says Preferred Vendors. We currently have, I believe, 66 preferred vendors in at least 57 or 58 categories. And as we say at the beginning of every single one of these webinars, this is a really good place to look if you are in need of new products or services. And note that all of the preferred vendors on this list have been vetted by the ACAP board, and each has been endorsed by at least one ACAP health plan member that has had a good experience working with the company. During the call, you may ask a question at any time. You do that by typing your question into the question box to the right of your screen. All questions will be fielded and answered at the end of the call. Now with that, I want to turn this over to Eugene Sayon. Thank you very much, Eugene.
Jenny, thank you so much. Foremost, we are absolutely delighted to be affiliated with ACAP. It's been a wonderful organization, and I'm happy to say that maybe I can extend myself a little bit here, but we're definitely building a great friendships, and truly we are delighted to be anyway affiliated with yourself and Maggie. You guys are doing a fantastic job. So thank you again for this opportunity, and we know that how busy everyone is these days, unlike planning for the next exchange 2016 enrollments and QHPs and everything else. So thank you again for taking the time out of your busy schedules and joining myself, and more importantly, Richard and his team at CHC. This is really a meeting or a webinar designed to kind of help you really understand what Richard and his team has done at using Softheon as merely a tool, as we call it here. So we have just about an hour, and our topic, as Jenny pointed out, we'll turn over to Richard and his team very quickly. So this will be one of these webinars out of respect to everyone's time. We will turn over to Richard first and his team to really walk you through, I guess, their challenges and how Softheon was able to address those challenges, if you will. And then we will continue with the Softheon's overall, maybe a broader introduction, if you will, and the way we see the how the marketplaces are evolving, especially in the eyes of Supreme Court decisions. But we also know that, as you can probably hear it from the the amount of disruption coming to the space, all the way at the levels of United and Anthems and Humana. Everybody seems to be kind of in a hurry, if you will, to rebuild and re-strategize their business value proposition too. So it's a great time to be in the healthcare industry. It's such an exciting time, and we are delighted to be having the opportunity to talk to you. So with that in mind, I'll turn it over to Richard and his team about community health choice. And Richard, I will be your driver. Just please do tell me when to go to next.
Okay. Hi, thank you, Eugene. We're community health choice. Right now we're in Houston area. We have about a little bit about history. We have about 260,000 Medicaid and CHIP members. Starting from 2014, we participate in health insurance marketplace. At that time, we have about 250 members. Very low membership is easy to manage. For 2015 enrollment, our membership increased a lot to close to 40,000 members. So at the time, we encountered some system issue. So one day I heard, Houston, we got a problem. Yes, we did get a problem. At that time, one important data field was not updated due to system issue is the APTC tax credit. And another issue is because it was not updated and we tried to void and reissue, the function didn't work. So that caused operational problems. Also, at the same time, because the membership increased, in a very short period of time, we have about 350 employees. And in 1 or 2 months, we hired 50 temps, trying to cover phone calls and billing issues. So we start to look for Softheon to help us to handle the billing and the collection function. First day of the kickoff meeting, I said, we have to send out our May invoice in April. That's the bottom line. So during the 90 days, both sides tried very hard to implement, and we did send out our May invoice on April 17th. So today, I'm very glad to invite several of our main key players on the implementation to share their experience. We divide our slides into 5 areas. So each one of them will cover 1 or 2 slides. We have our project manager, Alina Batu, cover the implementation. I will have my finance director, Amy Gray, cover the finance management. And I have Ulysses Manus, senior programmer, to cover information technology. And also I have our VP of operation to cover member eligibility and the member service cost center. My very high level feedback is since we start the implementation, we have a twice a week conference call to cover all the implementation issues. And also after the implementation, we still have the twice a week implementation call. So now is in the June 20th, we still have that twice a week conference call. I think it's good to have the same project manager from the implementation all the way. And also every 3 weeks, we have the executive steering committee, so we can work on some high-level enhancements down the road. So I'm going to pass the presentation to our first presenter, Alina. Let's move to the, yes, that's the one.
Good afternoon, everyone. My name is Alina Batul, and I'm the project manager at Community Health Choice. I'm going to be giving you guys an overall summary of our experience with Softheon. Following me, my colleagues will discuss more specific information related to different departments such as IT, finance, and operations. I want to start off by talking about data integrity. This was our #1 priority and concern when we began implementing Softheon. As Richard mentioned, we had a great increase in enrollment, and that really challenged our pre-existing enrollment and finance operational capabilities. So when we began the implementation with Softheon, what we were concerned about was the transfer of data and making sure it was accurate, and also our payment data for our members. Previously, during the initial enrollment period, as the enrollment was fluctuating and increasing, we had done a lot of manual work, and we were aware of some of the issues with our own data. However, having said that, the data transfer between Softheon and Community was a overall smooth process. Softheon was successfully able to take our enrollment data and attach it appropriately with our payment data. Although our testing time was limited when we went live, the testing that we did perform made us feel quite comfortable with the data integrity within the Softheon system. The second most important thing would have been the implementation timeline. As Richard mentioned, that was our bottom line. We had to generate the invoices on time and with high accuracy. We feel that Softheon team was very flexible with various situations that came about during the implementation, and that both teams were able to work together closely and quickly to get the project up and running. We truly appreciated that they were able to run some ad hoc processes and reports for us that really helped us transition internally to a new system, because we had QNext and Softheon, and they both needed to work together. And they were very helpful in that aspect. The last thing I'm going to talk about are some of the enhancements that we're continuing to work on with Softheon. During the implementation, due to our timeline, we moved past a few items that were not immediately required, but are very important to us as a company. One of the things that we would like to mention is that Softheon is a service provider. They're very standardized because they provide these services across the nation. Although that standardization has its benefit, there are some state-level regulations that we are currently not able to meet immediately with Softheon, and we are working with them to have those enhancements completed so we can be in compliance with our state regulations. Additionally, Community is a very, very member-driven organization. We do many things that are not necessarily required by CMS or Texas Department of Insurance. However, we understand the needs of our population that we are serving, and we continuously aim to educate and enhance the experience of our membership, many of whom are newly insured and bilingual. Some of the challenges include right now not having our member portal and website available in Spanish, also the pay-by-phone option, which is only in English. We understand that development takes time, and so we are waiting these enhancements to be completed by Softheon. The last item that I'll discuss is our continuing experience with Softheon software. We have had one project manager throughout our experience, which led to quality assurance, consistency, and a relationship building experience, pre and post implementation. However, in terms of technical support, our team received an initial training of about 2 days. During the process, we faced a learning curve that we had to overcome quite independently to resolve new situations or questions that came our way. As I mentioned earlier, we're member-facing and member-driven, and that requires a quick turnaround for any situation that could come up. And as we transition, that happens a lot. And this was an arena where we heavily focused with Softheon and worked through that to make sure that we had proper support and timely resolution of all the concerns. I will now turn it over to Tanya Wynn. Amy Gray, I'm sorry, for financial management.
Good afternoon. My name is Amy Gray, and I'm the Director of Finance at Community Health Choice. Just some of the things that impacted my areas of responsibility are what impacts everyone in the health insurance marketplace from a finance perspective, and that is all of the CMS rules and the guidance concerning getting the proper invoices to the members. As Richard and Alina both said, we had some system issues which led to a lot of overtime, a lot of weekends, a lot of late nights getting those invoices out. When we went with Softheon, we were able to determine and be very okay with the way that our membership fell out, and that the way the invoice is calculated and pulled directly from the lens of eligibility. And we were able to see that at Go Live. So that was a big concern of ours that kind of went away when we went live with Softheon. Another issue that impacted my team and our cross-functional team with operations was entering in monthly payments. As Richard had stated, we saw a very large increase in our population that we covered, and so with every new subscriber we added was another payment. We were doing all of those manually. So over the course of the first 2 months, we were entering in 20,000 payments manually into the system. And with Softheon, that decreased dramatically. I have to say that I'm getting a little more sleep. And we expect to see a greater decrease in the manual intervention as our new lockbox goes live. Subscriber refunds was another pain point for the finance department. We didn't have a way in our system at Community to identify the subscriber refunds as the changes in eligibility occurred. So most of the subscriber refunds were subscriber driven. Now with Softheon, we are able to get a report once a week to show those terminations as they occur so that we can process those refunds in a more timely manner, not waiting for the subscriber to reach out to us. And then lastly, another really big impact for us was the fact that our internal and our external reporting had been streamlined. Like I said before, lots of late nights, lots of weekends, just to get a report that appeared to be reasonable, and now we can use the Softheon tools to better report the information that we have. And with all of those happy things, of course, we're still looking for a few enhancements that are needed. As Elena said, we are member-driven, and so it's not the invoices, all of the invoices that need to go out. It's the one invoice to the one member. We want that one member to have a good experience. And so with that, we have several membership groups that we need to identify within the Softheon system so that our member services personnel can spot those members at a glance instead of having to look in two systems and coordinate while they're on a call. We also have a need to identify capitation groups within the Softheon system for the same reasons and for the same reporting requirements. So we have some things to work through, and like we mentioned before, having one project manager throughout the whole thing, an email, a phone call away. We've developed a good working relationship with him and very responsive. So that part of the implementation, although it went by very, very quickly, that has carried us through. So next we will turn it over to Ulysses, who will speak to the IT side of things.
Hello, this is Ulysses, and I will cover our experience with the implementation on the IT side. First, the importing of community membership to the Softheon was straightforward. After we did all the EDI configuration rules, we had the option of sending all the A34 files, original data, to importing to the Softheon system, or taking an A34 file from our system into Softheon. And we decided to go with taking the original data from CMS and put it into Softheon. And once that was loaded, we sent all the files to them, and they took care of it. They validated and let us know when it was ready, and they loaded all this into their model testing environment. Once it was loaded, we sent them the payment file so they can update the status of the members for effectuated cancellations and terminations to reflect our system. And then our users went in and verified everything was correct. And this is the same database or data that was promoted to production once it was verified by our users. So this was pretty straightforward. And the only other file that we we had to send two files to them: the payment file, which had a real simple layout with the just the main fields that were needed, and also the issuer ID file that contained the same IDs that we had in our system. And the other, we also had a decrease in the volume of files that we were exchanging with that we had, because we had a lot of files that were exchanging with CMS. We had to send them a TA1 file and a 999 file for each file we received. And anytime a member made a change in the exchange website, we would probably get like 2 transactions per file in that file, a termination and then an addition, which actually we had some challenges in our system trying to keep track of every transaction. Well, the volume of this, the number of files that we received from CMS went down, because now we're getting them through Softheon, and they're filtering it, because we're only getting effectuated members and termination members. So this really helped in our system. It made it a lot easier for us to handle, because with the volume we're having, everything was being multiplied. So now the Softheon was filtering the data, then it was a lot easier for us. For example, they also took on the role of handling the inbound baseline files and outbound baseline files, and so they're taking care of that, so we're not handling that anymore. And they also took over the role of receiving the pre-audit file, and they seem to have a more mature system, because they have an automation to use the pre-audit file to update the members in Softheon, whereas we had to manually use the pre-audit file to manually update the membership in our system. So it has been a lot easier working with Softheon, because it has taken a lot of the load off our backs. And also there has been exchanging data. We have sent a couple of files. I went over the payment file, the issuer ID file, but also we also wanted to see get data from Softheon to do a reconciliation, and we were able to get from them an EDW file, which is the electronic database warehouse file, on a daily basis each morning. So we can do a comparison and do some reporting along with our system to see the differences and make sure everything's online. And we also got another file that has really helped us, because before this we were giving our trading partners like Beacon and Navitas, we're giving them a pay through date file, because we didn't have a separate file from the 834 file we were sending them, because we were handling that file outside our system. So we wanted to keep that the same way, and we were able to work with Softheon. They were flexible enough to give us a pay through date file. So that really helped us to do business as usual. So we didn't have a whole lot of issues working with Softheon. Main issues. There is we also had some off-exchange members we needed to load to Softheon, and on this we couldn't send obviously we couldn't send the memberships from CMS. This is our data, so we were able to create an 834 file in the system, and we also successfully loaded that into Softheon, and we went through the same process. And if I wanted to make some recommendation on improvements, the only improvement that I would say is maybe have more training, so that everybody knows their role and everybody's responsible for a specific task, to avoid any issues or mistakes down the line. Knowing where everything's at, because it's a new system for everybody, so we want to know what exception queues we need to monitor. We know what reporting is available on Softheon, and make sure who needs to track what on Softheon, because this is going to be a new system for a lot of people, and I would like to know maybe a description of the different roles and their duties, so that everybody can just switch over to Softheon a lot easier. So maybe training would be an improvement that I would recommend going forward. That's it for me.
Good afternoon, everybody. This is Tanya. I'm a VP of Operations.
I will go ahead and cover our two area, member eligibility and our call center. First of all, from a member eligibility team, we feel that the Care Portal is very user-friendly and also very intuitive. Although we have a short period of training, after you go into the portal, you experience with the update, you get a hang of it, so it's not very difficult to maneuver on the portal at all. The additional plus is the accuracy of our enrollment data. As you hear Ulysses mention that the pre-audit file, it is a manual entry for us, so having all those files loaded accurately and on a timely manner, that helps us without jumping from file and data to look up our member information. Another positive note for us is that all the dependent and the subscriber is in a folder together. That is make it very easier for us to view all the information within the family. And last but not least is the ability to view all the account history and eligibility enrollment for our member in our carrier portal as well as the web portal. However, one of the enhancement or maybe is something that our team would like to see is fewer steps to update, because you got to go through multiple tabs to update a record. This could be a learning curve for us, or this could be something as a enhancement that Softheon can consider down the path. But we feel that overall eligibility team were pretty happy with the results. Eugene, next slide, please. For the Member Services Call Center, again, we have roughly about close to 40 call center reps that handle our call. We have member calling us, and we feel our member is very comfortable with the web portal. They feel it's friendly for them to use, but we're available on the call if they ever have questions. We navigate and we'll assist them through the portal on how to do their eligibility or their member lookup and their invoices. The member can view the invoice on the portal, and they're also available on the carrier portal for our staff to look at our member as well. Another positive note for our member is that it's very easy for them to do payment online as well as e-check and pay over the phone, which is a two feature that we did not have in our previous system. So this is something that is a positive note for our member. Another tremendous benefit for our member is the setting up of the recurring payment on the portal. That is very easy for our member, although it requires some training that we walk them through. But other than that, it's pretty easy for them to set up. As we mentioned a while ago, we do have a large number of Spanish members, and there are some pockets in our service area where English is a second language and Spanish is the primary. So we would like to see the web portal rolling out Spanish version soon. This will help us reduce our phone call as of now. We're taking those phone calls to assist our members who have Spanish-speaking member only. So that's pretty much cover our call center. I'll turn it over to Eugene.
Thank you very much. At this point, I know you are very busy, and I know you've been working very hard. So if there are any questions for the CHC team, Richard, Lena, Amy, Lisa, everybody. At this point, for any questions that you may have for our speakers, and then we will proceed with the remaining of the presentation. Jenny or Ron, would you like to take the lead, or if you have any questions, please?
Right now, we don't have any questions from our audience, so I believe we can just push on through.
Okay, well, we'll do. Again, thank you very much, and for this wonderful introduction. I couldn't do a much better job, and we are truly grateful for the partnership that we have built with Ken and his team up there, and Richard and everybody else. We are truly grateful for all the support and guidance we get, and we're absolutely delighted to have an opportunity to give their weekends and their quality times with their families instead of working on an 834 or premium billing issues. A quick introduction to Softheon. Softheon is a U.S.-based organization. We are located in New York, and our core competency has always been around technology. We are a 15-year-old technology company, has been working with many different aspects of healthcare, definitely prior to the ACA. And our introduction to ACA was, in fact, back in 2008. The nation's very first data exchange needed some technology, and Softheon has been one of the critical technology providers to Massachusetts, aka RomneyCare, for the exchange needs. Today, we're happy to report you that we serve nearly or over 50 health plans, including Community Health Choice, MedWise, another ACAP plan, as well as Affinity New York. Last year, we had the opportunity to serve Care Oregon and Contra Costa, but they decided to kind of exit out of the exchanges, and I expect some point in time they will move in, which is another great story there, by the way. We were able to help them out and to kind of test the waters, if you will, without going through extensive investment on their end. So they were able to kind of go in and out of the exchanges and kind of see what it means for them. But again, another compelling story, we believe, because it prevented them making some significant investment, and typically in IT investments, as you know, it's normally a 3-year ROI you look for it. So Softheon is really a platform that we are discussing today, as we call it, Softheon Cloud or Softheon Marketplace Cloud. And there are critical components of it. One big advantage of it, it is a fully integrated system, all the way from portal, where to do 834 enrollment processing, eligibility component to it, premium billing, even fulfillment. In the case of CHC, we have not really extensively used our fulfillment capabilities beyond sending the initial and recurring invoices, but we have organizations that we work with where we do other aspects of fulfillment all the way up to the ID cards. On the premium billing component to it, we also provide a fully integrated payment portal, as we call it. Softheon is a PCI Level 1 certified organization, so which means basically our payment portal, it literally, upon taking the payment, posting into the member's account, and then the next minute, if you will, those funds will be then deposited to the bank accounts, and where we do the reconciliation on a nightly basis, and the very next day or two, in most cases the next day, is those funds are being then transferred to our carrier's account. So this applies to the lock boxes. This applies to also ACH direct deposits, as well as credit card processing. I'm not going to spend too much time on this slide. It just shows you the depth and the breadth of our technology. But what is one thing noteworthy here, you'll see where we define as a carrier, and this is basically Community Health or MedWise or Affinity or one of our 50 health plans. That is the only tool interface that we provide, is basically the 834, daily 834. Of course, we do provide other things like CMS baseline files and pre-audits and everything else, but on a day-to-day operational, it is a minimum interference, minimum disruptions to our health plans to be functional and fully operational in exchanges, facing and servicing hundreds of thousands of members as we have today. As we call it, if you ask me, what can you describe Softheon in one sentence, that really is what I would call the saber of health insurance exchanges. Now, for those of you who travel quite often, probably you may wonder, if not, maybe you already know, that how does Expedia, Travelocity, and all the other hundreds of thousands of websites pull in real time a flight information, seat availability, and price. And the magical thing there is the airline reservation ticketing system is called Saver. So in essence, that was our inspiration when we looked upon Softheon in the early days about how we can help our carriers, health plans to be successful in the exchanges. So in this context altogether, Softheon is connected to so many, almost every state exchanges and definitely federal exchanges. We are in the process of integrating with other private exchanges where we are able to provide those QHPs on off-exchange through multi-carrier private exchanges. We are also receive a designation of a web-based entity because of the work that we do quite extensive with CMS. What that means, in essence, if the HealthCare.gov is the Costco of health insurance, Softheon and WellFields is actually the BJ or Sam's Club. I'll make a very simple analogy. We will be able to offer nearly 80,000 QHPs from 400 carriers through our WellFields consumer-facing, direct-facing, and that is, again, that is our health plan. That will be CHC and QHPs will be producing or marketing through that process, as well as MedWise, any one of our health plans. On the back-end side, we have done over 15 plus years of integration, so we are fully capable of integrating from QNX to the facets to Amesis. So we have everything is pre-wired. Another term that we use is putting more cars into the Softheon highway, if you will. The roads are already built. There is no reason for our carriers to build their own roads from where they are to state exchanges. Proud to tell you that we're over now close to 500. This year we're nearly 1 million lives on Softheon today, and we are expecting to process nearly $500 million in member premiums through our premium billings and our payment portal platforms. So a little bit of a forward-looking statement subject to what may come out of the Supreme Court, but the Congressional Budget Office still predicts about nearly 20 million people will be on ACA, which will be slightly increased from where it is, nearly a double increase, I will say. But again, if you take into the other implications, again, even if it is 15, 18 million, we think that the growth in public exchanges will continue to accelerate the consumerization of health insurance products and services over the next 2 or 3 years, and the transition, the acceleration or the formation will be transitioned into the private exchanges in 2016 and 17 and beyond as well. Now, so it's a growing market. On the opposite side, if you look at it, there is definitely a steady decline on the employment-based and a non-group-based coverage over the same period expected for the projections. We believe overall market, and this is where we highly encourage you. Now, I've just told you that it's the barrier of entering the ACA and marketplaces. I think that we take great pride. We love to be able to, speak with any one of our ACAP members and helping them making that transition or experimentation, even to a certain extent, at a very least risky way. Implementation, again, as I said, it takes now months, not even maybe possibly a week very soon. We are constantly improving our product and services. And on the upside, according to Accenture, according to even Mark Bertolini, now is about basically 100+ million people will be buying their product, health insurance product, through the exchanges, and there are so many variations. Once again, even if it is a plus or minus 20-30% error margin, if you will, we are talking sizable number of memberships moving to the ACS. Even on a repeal case, we are now hearing from the Republican aisles indicating that they will continue to fund the processes of exchanges with some minors. And in that context, Medicaid took about 15 years to come to the current final stage. And if you look at it, ACA hasn't been amended once. So we believe there will be a series of amendments throughout the next several years, whether on the Republican or Democratic side, because the overall sustainability is in question because of the fact that some of these operations are being built in a way that is really not as sustainable the way to do these things. And we believe technology companies like Softheon is offering a cloud-based platform and making that investment in a much more meaningful way. So the next portion of it, again, focusing on the uncertainties. Even if you are in the ACA, I think one thing you really need to embrace is the ability to change. We helped about 3 or 4 of our health plans in Oregon last year when they decided to move from basically when the Oregon Exchange shut down their operation, and our plans literally had about no more than 2 or 3 months to move to federal exchange. I'm pleased to report you that we were able to do that for all of our carriers. We are talking about some of our carriers might be moving back. The states like, the Pennsylvania is considering starting their own exchanges. So what makes the Softheon value proposition? It's just not on a day-to-day operational, but if you look at it beyond 2, 3, 5 years as a strategy about how to reach a consumer. If you think about it in that context, Softheon becomes your wholesaler of your QHPs. We are then responsible of sending those products to all these different retailers, let it be private exchanges or public exchanges. And then we're also responsible of collecting all the fees, all the billing, just as Sabre does it for Delta or American Airlines. Our mission is pretty much as simple as that. And we believe the change will continue to happen in the marketplace depending upon really whatever comes out of the federal or state laws. This is a simple data diagram, so we'll take maybe a minute or two. We are able to consume pretty much every data format from every state exchange. Every flavor of 834, we are able to consume and analyze the data, and then we create a real-time transaction. So Softheon has a built-in real-time component to it. In fact, we have one large carrier that we do real-time. In other words, we take the 834 from state and federal exchanges, and if everything goes well with the 834, there is not a data issue altogether, and we are able to do a real-time quote to card. Individual's ID card will be literally on its way to the fulfillment, if not online to the portal. We feed that into our master data, as we were talking about our enterprise data warehouse, or our electronic data warehouse, as we call it, Ulysses was referring to. One thing about Softheon, we want to make sure that we have a 100% transparency. So it is your data, even though it is a cloud system that we're able to get it up and running for you in a matter of weeks. But we take great care of your data. So we will love to be able to talk to you about how we make this data available to you on a daily basis. So you can do your own reconciliation. You can do your audit process. We have to earn your trust. We are a strong believer of that. And in that context, we're not offended if you question every word that we are saying. We encourage you to do that. So in that context, that basically we handle the plan management, enrollment, financial management data warehouse, and CRM component through carrier portals. So we have a broker portal we've implemented. We have a member and employer-employee portals for small group coverages and large group coverages as well. And we do lots of analytics. We are a data company. We've always been a data company. And in fact, you're looking to some of the samples of what we provide on our data reporting component to it. And Richard and team hasn't mentioned, but they will be actually receiving a note from us. I think recently joined us on a webinar. We have an electronic dashboard for the executive team. Gives you a real-time access, real-time information about your enrollment, your pay-through date percentages, the revenues received, distribution of revenues by credit card versus lockboxes, and so on and so forth. And again, I think the cloud has matured enough. If you are using Facebook, if you are using a Gmail for your personal, if you are in online banking, these are all great cloud applications. So we believe that you are able to build, operate model. Now you can transition into the governing model. We have a strict SLAs that we work with our health plans. We give you the full transparency. We become simply an extension of your IT organization with nearly infinite resources. We size up our systems around open enrollment. In a matter of hours, we can grow it up to handle that massive influx of activities. We downsize at any given time to give it the optimum response time, and we become basically an extension, again, as I say, of the organization, both technology-wise, technically, as well as operationally. And we believe the transformation will continue as we call a single carrier versus a multi-carrier. Once again, today there is Expedia.com and there is a Delta. There is a good reason for both of them. So the experience that we create for our health plans, including Community Health Choice, has been around not only helping them, their QHPs, to be sold and marketed through FFM and perhaps other exchanges as we go down these partnerships. We are definitely excited. We want that partnership to go even beyond what they have experienced, even though it was an exceptional, phenomenal growth. But I think that in the age of consumerism, that we want to be able to grow the business, and we want to be able to handle those exceptions, and we want to let our friends at Consumer Health Choice really focus on the care aspect to it, service aspect to it. Let us handle the kind of the minutiae, if you will, dealing with the government, dealing with the states and billings and banks and whatnot. But we also want to create this life experience, like the Delta.com does it, where consumers not able to do it on Expedia, like how you do your frequent flyers, upgrading your seat, and so on and so forth. And that's how we view our portals that we provide. The portal that we built for Consumer Health Choice is designed to be giving those consumers the ultimate experience, like as we talked about it. We are implementing our Spanish version of it very shortly. We have an IVR phone lines. Once again, we wanted to enhance and reinforce the Consumer Health Choice brand in state of Texas and in Houston and beyond, hopefully, too. We have a continuous product timelines. We are building the next generation of our platforms, especially around mobile technologies. And again, our goal is to continue to enhance the value that the Consumer Health Choice members get from it through the product and services that we would like to be able to offer to their plans and to the CHC. So with that in mind, I want to say thank you very much for your wonderful, for this wonderful opportunity, and we are open for your questions or comments and concerns and everything and anything. This is an ACAP only webinar, so I guess we're among friends. So please do let us know if there's anything that you would like to discuss, and we are here to answer. Back to you, Jenny. Ron?
Okay, our first question today. What criteria should health plans and organizations use to develop a long-term and sustainable strategy around exchanges?
Maybe I'll take a first step. I don't know if Richard is still with us. What we do here, we have, for instance, we have some larger carriers, especially multi-states. And really the strategy should be about, as you are going into it, everybody talks about consumerism and the retail. And what makes the retail business so successful is the supply chain management. So you can definitely do factory to direct model as well too, but in the supply chain model, that there are entities and organizations that are much closer to the consumers, let it be brokers, let it be, again, other private exchanges. So then the question becomes, how does a health plan is able to connect with so many retailers, if you will? And that's what I use the term about Softheon becoming a wholesaler. So if your strategy is to participate in multiple exchanges, I think that it is important to have a holistic view of what exchange operations means to you, and how do you build those core competencies along the way, the operational skills. Look, 15 years or 20 years or 30 years of investment the carriers have made their organizations. It was wonderful. It worked wonderful things. But in the day of consumerism, the way of individuals looking for the type of services, they are spoiled in a way that with Progressives and Schwab's or online banking. That's the kind of expertise. Now, if you get into the world, now you're in a complete different place, if you will, because now you're dealing with PCI requirements. You're dealing with approach and truly teaming up with an organization. Softheon is one of them. There are a few of our competitors, and there are a few other preferred ACAP vendors that I'm sure Jenny will be more than happy to connect you with. So working in team spirit partnership with a technology and operations oriented companies is probably the good way to start this. If you are to evaluate your overall exchange strategies, especially in, again, as I said, multi-channel format. Would you like anything else, Richard? You're still with us?
Yes, Richard's here. Let me add one item. The marketplace membership is very sensitive to premium. So maybe 1 year we have a very low membership, another year very high membership. So in my mind, one of the key factors is if we can control if in the same area everybody's medical cost is about the same, then administrative expense, PMPM, will be very critical. If we have very low membership, then our fixed cost will be pretty high. That's one reason we want to outsource, because once we outsource, then the PMPM for AR collection, that part will be, it's like a variable cost, a fixed PMPM. So to me, that is one factor we need to consider about.
Thank you, Richard. That's a great point, by the way. I failed to mention that our business model, our revenue models is based on PMPM. So to Richard's point, we are as happy as he is when the membership goes down. When the membership goes down, we're upset with it. But one thing for Richard is that his expenses control, so he doesn't have to do this, bill day will come mentality, if you will. And we are hearing some pretty bad stories from some of our carriers that actually went and spent a lot of money. And we are now actually have been working with some of them altogether, replacing some of the alternative solution that they try to build with other vendors. So there are not only about, I think, to Richard's point, not only about how to do the strategy, but also there are new ways. And that's why I think the cloud concept makes perfect sense. And I think that we have proven, not just us, but as an industry, its maturity is here, security is here. It's really nothing intimidating about cloud, and that's where the biggest benefit is about that cost structure. Basically, you have the full control over as your membership goes up and down in a very volatile marketplace, as we know. Thank you for that, Richard. Great point. Back to you, Ron.
Okay, our next question. What are some of the hidden risks and pitfalls organizations must avoid when building and operating exchanges?
I think this question is for Richard rather than me, maybe, but then I will answer it after that. Richard, you have anything?
Yes. One area we noticed that is for this population, sometimes they don't pay premium on time. So to me, potential risk is when to do the cancellation, when to do the termination, when to send out the grace period letters, because that is not risk on the financial side, also will have some risk on the compliance side. So if we know the best practice, that will be helpful for us. So I think that's one benefit. We partnered with Softheon because they have other 50 health plans, so they kind of know what other people are doing, so can give us the feedbacks.
Another great point by Richard. So what is important, we believe, is in that sometimes we know one of our carriers, one of the potential risks is that they have experienced was the adverse selection. So they have a very high utilization. So the product pricing is also very important. One of the things that we do during the early phases of QHP design and product pricing, in fact, as I mentioned, we have 80,000 products, 80,000 QHPs because of our relationship with CMS through also directly and through web-based entities. So we are able to basically determine what is a really a good price point that you may want to be. Sometimes you don't want to be the cheapest price in that market altogether. So it requires some due diligence and market research and analysis. We do what we call a conjoint analysis here. We do make some recommendations with our health plans where we think that they should be within the given market, given product pricing altogether too. And then I think one of the biggest risks is the organization's readiness and maturity to take on exchanges. It's a very different business model than what you might be familiar with on the Medicare and Medicaid arena altogether. to Richard's point, I don't know, Richard, if you can share some, numbers about how many calls you were getting maybe before Softheon or even after Softheon, but during the open enrollments, we see carriers are getting basically, beyond their capacity in their call center. So you need to basically prepare for this massive influx, and that's why I think one of the things that we are very proud, our partnership with CHC, that we're able to offer some of that overflow capabilities with a full transparency of the data in both ways.
Right. Before the implementation, because we have the billing issues, we have about 1,200 phone calls a day for Marketplace. Right now, that number probably down to 500 to 700 a day, because right now we have fewer billing issues. Also, at the beginning of the year, because we have too many phone calls, we also we use another call center to receive some overflow phone calls. But that is important. Sometimes we don't. It's very hard to anticipate how many membership we'll get for next year. So we always need to have a way to have a plan B, can take extra phone calls.
Thank you, Richard.
Okay, that takes care of our questions for today. I'd like to pass it back over to Jenny.
Thank you very much. Actually, I have a question, if it's not too late. And Eugene, this is for you. What will you advise your plans, your issuers in the federally facilitated marketplace to do should the Supreme Court come down with a decision for the plaintiffs for King later this month? How will you advise them to go forward, given the lack of guidance from the administration, right, and what could be serious confusion?
That's a great point. So again, I wish I had the crystal ball to tell you really what's going to happen. But one thing I will say is sit tight. I mean, to be honest with you, I think that any decision that comes out of the Supreme Court, the effect of it, I don't believe will have any significant effect until 2017 or so. We are seeing already, for instance, that like the state of New Mexico, as you know, they've been quote unquote leasing the exchange from the FFM, and I think we're going to find some creative process on the administration side about to circumvent the immediate impact to this piece, even though the secretary just announced that they don't have a plan B. They kind of really playing a little bit of a sandbag there, in my personal opinion. But I think if you look at it, that as a part of the law will continue, and then the adoption will continue. We don't know what the effect of immigration reform to a certain extent, if it happens. Will that bring another 5 million or so of population, especially in the areas like Texas and Arizona and California? So I think that exchanges are here to stay. I mean, I think a number of people now opposing the kind of trying to do full repeal, even within the both sides of the aisle, is nearly as just as few as people possible. So the question really becomes is, what happens after that? I think what we'll see is there's going to be some revision to the ACA. Let it be some, I fail to remember his name, a Republican senator from Nebraska. He was talking about extending the COBRA laws and states so that the states are making the contribution to the individual's account. So the subsidies, in other words, coming through that kind of a quick hand change. I've heard some conversations about revision to the health reimbursement accessibility, HRAs, if you will, and where once again a subsidy is making way in the form of a reimbursement, other type of incentives. I think the consumers got their taste of it. They're looking for a choice, and as the membership increases, there's definitely going to be a market for it. So our advice right now is to our health plan to really kind of sit tight. We don't believe the impacts will be a very sudden, very, very disruptive. Now, if they remove the individual mandate, that will create some havoc. I will say it right off the bat. But by the same token, I think the the mandate really didn't play a lot of significant role for the first 2 years. If you look at it, we still have a very high degree of, people population still being uninsured, and so the penalties and mandate has been a kind of negligible. I don't think that even if they remove the penalties, the people who need in healthcare are going to get healthcare, and they're going to look for choices. And we're going to see the private exchange side of the business picking up with some of the large organizations like Walmart, like Walgreens, dropping the temporary and the part-time employee coverages, or pushing their minimum wages into the exchanges. And I think we're going to start seeing some deregulation in the areas where we'll give more choice and more flexibility, less mandate perhaps, and that could be an okay thing to do in my view. I'll turn over to you, and maybe also I should be asking the question to you with all the respect. I think, Jenny, you're much closer to the capital than I am from New York. So, and as well as Richard, I will turn over to you as being the people who are kind of in this conversation on a day-to-day.
Richard, would you like to address that?
We are, of course, we're very concerned about that. You're talking about the King cases?
Yeah, we're talking about the Supreme Court case, the King case.
Yeah, actually, our CEO talked about it this morning. Right now, to us, is we wait for Thursday, Friday, or Monday. We're going to know, and we will have a plan B. But right now, I think we're still more optimistic.
I like that. That's good. Well, ACAP will be holding a couple of telephone calls, roundtable calls after the King decision comes out. You will get notice of those as soon as the decision comes out. That is the folks that are on the ACAP Exchange roundtable list, and I think all of the CHC folks are. So thank you again so much. Everyone at CHC, I really enjoyed your presentations. It was very nice to hear each of you with your expertise provide input on or provide feedback on the process. And Eugene, it's always a pleasure to hear you. I feel like this is a very valuable webinar rather. And I just wanted to let you know again, remind everybody on the phone that this recording and the slides will be posted on ACAP's website, and we'll be sharing that with other ACAP plans as well so that everyone gets a chance to hear. So thanks to all of you. Everyone have a great afternoon. Take care.
You're welcome.
Thank you all. Thank you, Richard, one more time. Thank you, Ron and Jay.
Thank you.
Thank you. Thanks, Eugene. Thanks, Richard and all. Alina, take care.
Thank you. Bye-bye.